Friends, you know the brain stroke. Brain stroke of many types. Most common is blockage of blood vessel. We have told many times about it. Now let us come to the type called hemorrhagic stroke, which occurs though it is a less amount, like maybe occurs in a 20% of the patients. It is hemorrhagic stroke, but it is catastrophic stroke. I mean, hemorrhagic stroke will lead to the life loss, that is death of the patient in many times, and outcomes will be very bad. Here is one case where 47-year-old female had come with an history of sudden, like thunder type of headache, thunderclap we call it, as sudden headache, which is like we can explain that they had a severe headache in their lifetime, never had such an headache in their lifetime. Such an experience, when it is got, usually it is subarachnoid hemorrhage, we call it as SAH. It is rupture of one of the weakness in the blood vessel, and that ruptures and the blood leaks and collects around the brain. So now in such condition, what is the treatment? The two principles here is we have to stop the blood leaking again from the same aneurysm. That is, re-rupture of aneurysms we have to stop, because already there is some amount of leakage which has gone around the brain. If once again it ruptures, more blood and more chances of mortality, that is a death. Here now the principle is we have to stop the blood leaking again. Friends, it is just a few seconds of leakage which leads to the condition, maybe unconscious of the patient. But we may think that again leaking will be continuous. It is not so. Few seconds it leaks and stops. That much of blood is enough to kill the patient. Imagine if it ruptures again, there will be more chances of death. That's why hemorrhagic stroke is very dangerous. Now, how to prevent the rupture of aneurysm or whatever the weakness? There are two types. One is open the skull and put a clip so that the leakage will be prevented. That requires patient has to go to the OT, open the skull and the layers of the brain and enter into that intricate process, and recovery will be late. Now is the advanced technology where there is a pinhole. We enter into the groin, sometimes in the wrist, like an angiogram of the heart. Similarly, we do angiogram of the brain, and we enter through the blood vessel, and that is called endovascular coiling. And coil is one like a spring type of thing. When based on the size of the aneurysm, we select that particular coil and push in the catheter entering into the aneurysm, so that it will form a basket and fill that weakness and close the aneurysm from inside. It is just half an hour to 1 hour procedure. Patient will be under anesthesia and will be will come out of the anesthesia once the procedure is done. Maybe next day itself, patient will be fine. That is an advancement. Recovery time will be very fast, and the success rate and patient survival will be better. Now, the second reason of treatment is whatever the leakage of blood is there around the brain has to be resolved. That will resolve automatically over time. Here in this case, I want to show the live demonstration of aneurysm, that is weaknesses. Two aneurysms were there, one in the ICA, that is main blood vessel inside the brain, and one is a MCA, and it is little branch, one of the branch of the ICA is called middle cerebral artery. Two aneurysms at a time we coil. Imagine opening of the skull and clipping of those aneurysms would have taken hours together, and the outcome also would have taken recovery longer time. This patient has recovered faster, and recovery survival was better and recovery was fast. So this is an advancement where the open surgery is avoided, and endovascular technically we can coil the aneurysms or treat the aneurysms, and the outcome of this hemorrhagic stroke is excellent by endovascular method. This is the case we want to demonstrate live demonstration of this aneurysm coiling. This is how the left MCA bifurcation aneurysm, you can see the coils, there is no filling of aneurysm which was previously filling. Another IC aneurysm, you can see this coils also, it is in place, there is no leakage of contrast now. This is the procedure where this is the road map in which the we can see that it's just like a highlighted white background. You can this is called road map. We are trying to catheterize selectively into the IC aneurysm. This aneurysm is carefully we have to catheterize using a micro wire. The tip is shaped such that it enters into the aneurysm. Then following that micro catheter is pushed along. Then after continuous coiling is done into the aneurysm, once the placement of microcatheter tip, this is the first coil we are introducing into the aneurysm. This is a 3D coil which has to be placed to form a basket. Within that, multiple other coils are introduced such that the dense packing of this aneurysm, so that the principle is to strengthen this aneurysm such that it won't rupture in the weakness, so that the blood will not enter into the aneurysm at all and it remains in the parent vessel. So in the open surgery they clip it. Here we are filling this weakened part of the blood vessel such that it will not rupture again. That is the principle. Here we have introduced the densely packing using a first coil. So now followed by another coil, and such that the aneurysm will never fill once we inject a contrast at the end of this coiling procedure. Incomplete coiling is also dangerous such that it may refill and it may rupture, and that's why we are packing densely such that it will not leak again. So this is the second coil we are introducing into the first coil where the basket is formed. That is called 3D coil is first one. Next is we filling coil which will fill the interstices, whatever the gaps in the first coil, such that there is no leak of any blood, hence it won't re-rupture or any recurrence will be there. That is the idea of second and third coil introduction and what is called as dense packing of the aneurysm and complete successful of the aneurysmal coiling. After completion of the IC aneurysm, the same side there is an MCA bifurcation aneurysm which is very small and wide necked. But in this case, taking a balloon was also a risky procedure. Hence, we used only simple coiling, coiling the MCA bifurcation aneurysm. It was successfully coiled using a single coil, hence there is no leakage or complete secure of the MCA bifurcation aneurysm. After completion of both the aneurysm coiling, you can see this there is a complete secure of aneurysm, no filling of the aneurysm, patient is safe. This is a complete successful procedure. In the fluoroscopy, this thing you can see two markers we can see, that is the metallic coils. So this is a complete secure of aneurysm.